So Michael, doing my daily rounds, one of the things that I've been finding is staff have been coming up to me on multiple units and telling me, I'm having a struggle. I'm really having a hard time. I'm angry and I've lost my compassion. Is there anything that you can give to us that can help our staff to be able to resolve those issues of anger and to rekindle that compassion inside of them?
Yeah, Duane. Particularly when we bring up anger, and this is something we deal with a lot with military and first responders as well. Mm-hmm. I think sometimes anger is looked at as a bad thing. It is a negative emotion. It's considered a negative emotion. And I think people, when we talk about anger, it's like, well, you're just trying to make me less angry, and I need to be a different emotion. And I do want to say that it's not necessarily the case, right? It's just, to me, are you angry with the right person at the right time to the right level at that time? And if not, and that's not very effective for you, then yeah, we probably do need to look at, what do we start to do? Mm-hmm. So taking a look at, number one, what's causing the anger. So one of the things that we talk about a lot is what's called the ABC model. Mm-hmm. So this model has been around since the 50s, mid-50s. Dr. Albert Ellis,
right,
father of cognitive behavioral therapy. So cognitive, what you think, leading to behavior, what you do. Mm-hmm. And really what it does is it breaks down what happens, your thought about what happens, and then that thought about what happens then triggers your emotions and reactions. Yeah. So if you're finding yourself feeling, super angry about something, being able to have the self-awareness to kind of rewind into the situation and figuring out what was I thinking about what happened, because given that model, what it says is your thought is what's driving that emotion.
Yeah. Do you have an illustration that would illustrate the concept of the ABC model?
Sure. One easy one that a lot of people are familiar with is getting cut off in traffic, right? So if we break down the ABC model, so in his model, the A stands for an adversity. So in this case, the adversity is you getting cut off in traffic. So then the next piece is the belief. So what is your thought or belief about getting cut off in traffic? Meaning your interpretation of what getting cut off in traffic means to you. The B is your belief. That is basically your thought. So your interpretation of getting cut off in traffic. The C, consequences, are your emotions, how you feel, your reactions, what you do. And the reaction is twofold. So that is what you do physically and what your body does physiologically, like increased heart rate, sweating, things like that, right?
Yeah.
So in this case, the A is getting cut off in traffic. So if you have a thought of, what the heck, then what do you feel when you have that thought? Well, I feel angry. What do? Maybe I grip the steering wheel tightly. Maybe you use a hand gesture for some of us. You choose,
yes,
right? But the whole point is that thought, what the heck, is what drove that emotion and that reaction. So a lot of people think that the A is linked to the C. Because I got cut off in traffic, that's why my blood pressure went up. That's why I gripped the steering wheel tighter and used a hand gesture. And really what this model is telling us is, no, that's not right. You gripped the steering wheel tighter, used a hand gesture because of what you thought about getting cut off in traffic. And that's a pretty powerful thing for people when you realize that is how things work, because you don't have complete control over what happens to you on a day-to-day basis. Mm-hmm. You do, however, have control over how you think about what happens to you on a day-to-day basis. And that then gives you, so says the model, complete control over how you feel and how you react. So if we go back to what you were talking about of people trying to really grab a hold of their emotions, being able to rewind and understand what you were thinking and have that self-awareness of what was I thinking in that moment will then give you the power, because you can change thoughts. Right. So further down the road, if you experience a very similar situation, being able to change the thought in that situation will then either completely change the emotion, or in this case, sure, if anybody gets cut off, you're probably going to be angry. But maybe that anger is not as high, and you drop it down to, instead of super angry, to a mild frustration. And for some people, that can make all the difference. And I would say even for leaders, that makes an even bigger difference, particularly for those in which they lead, who are looking to them to be the example.
Right. And when you use that word, what and identifying the belief. It's so non-judgmental. Instead of saying, why am I responding like this, which means there's something that's wrong with me, the what is experiencing something's happened to me. And I've developed a belief around this that I'm responding to that belief.
Yes. And it's super important to be as raw and uncensored as possible. So obviously this is a professional video, so we're not going to get too into it with the thought, but you want to be as raw and uncensored when you're thinking about these things as possible, because that's going to give you the most self-awareness. And that's what's really going to drive you trying to work your way through these things. And then, yeah, non-judgmental. I really try and stay away from using positive versus negative, because there, when you say positive, negative, you are placing judgment on it. So really it's just, I had these thoughts or this thought. What was it? How did I feel? How did I react? Boom. If I need to be a little bit more effective in a certain situation, then I need to go back and be able to change the thought to lead to a more effective reaction and or emotion.
Let's bring it home, what we're talking about here at the hospital.
Sure.
Do you have any illustrations of how that ABC model can be used for our staff?
Yeah, so a pretty common example that I think that everybody could relate to is, let's say that you are on your way to work and you get a text message from a coworker on the previous shift. And that text message reads something like, wait till you see the clown show that you are about to walk into, right? Yeah. So boom, that's your adversity. You know that there's an adverse situation waiting as soon as you walk in those doors at work.
Yeah.
Right.
Well, and it makes me wonder of how many times do they get that on the way home when their spouse or significant other sends them this similar type of text.
Right. So yeah, happens at work, happens at home, and a lot of stuff that we talk about in the courses is applicable basically anywhere. Yeah. Right. But again, so you get that text. That is your adverse situation. Right. So here I'm going to ask you to skip the belief part for a second and go down to the emotion and the reaction. So if I get that text, how do I want to feel and how do I want to respond, react when I walk through those doors at work? Because if I don't pre-plan this, I'm leaving it up to chance. And we know a lot of people, when they leave things up to chance, they don't feel and respond in the appropriate ways. Right. Right. So adverse situation, I know I'm walking into a clown show. Skip the belief part, go down. How do I want to feel? How do I want to react? Then once you have how you want to feel, how you want to react, you go back. What is a thought that you could have when you open those doors that is going to make you feel and or react in a more appropriate way?
So Michael, in essence, what you're telling us is that these principles work anywhere. They work here at the job site, they work at home, they work out in the community, at the grocery store, at the supermarket, anywhere that we're at. They're all transferable no matter where you are.
Yes.
Excellent, excellent. Michael, thank you. I think this is a really great tool that's going to help so many people to help navigate the anger feelings that they're experiencing, but also other feelings that are rising up during the workday.
Thank you, Duane.